investigation on how to improve Gwira podcast. Today being a Tuesday, our topic is children and their well-being. And today we'll be specifically looking at nutrition and physical activities in children. And I'll start by asking, what are the importance of nutrition in children? So we'll see that nutrition in children helps children to grow strong bones and strong muscles. Secondly, it helps them to develop a healthy brain and nervous system. Also, good nutrition helps children to fight infections and illnesses. And if they also have good nutrition, it helps them to perform better in schools. And if they are good in physical activities, it will help them to maintain energy for play and other physical activities. So we'll see the several common nutrition problems in children. And the first one, we have undernutrition. We have children who are malnourished. And this can be caused by poverty. It can be caused by lack of education, because there are some people who don't know what they're supposed to feed their children. You see, their parents, especially mothers, once they give birth and it's time to attend clinics, because in these clinics, the postnatal clinics that they take their children to, that the several hospitals provide education on how to take care of these children. But you see, some mothers, they assume to be so busy, they pretend to be so busy, they just come for the vaccines and they go home. They don't have time to attend these postnatal clinics and the education that they are offered there. So you find some parents don't have the knowledge on what they're supposed to feed their children. So this leads them to feed their children foods that are not nutritious. So the children are under malnourished because of this. And you see, this becomes a lot of things, it causes a lot of things, because there are people who will have stunted growth. They'll not grow, they'll not grow, their height becomes stagnated, and their weight also they don't increase the weight, they're just there. So they have stunted growth. They'll start wasting. You find children losing weight. You see, it becomes an effect. And also, we have children who have weak immunity because of lack of good nutrition. Also, poverty. We've said poverty can lead to malnutrition. And you see, a lot of people are not able to provide 3 square meals, and they are not able to provide even a healthy meal. You find that there are children who are fed carbohydrates only. So they lack proteins, they lack vitamins in their food, they lack fruits. Poverty has made a lot of children to have malnutrition. So I think the government can also chip in and start helping parents who are poor, at least to provide good nutrition to their children. Another challenge is overnutrition. We've seen a lot of children who eat a lot, and not only eating a lot, they eat a lot of junk, they eat a lot of specific foods, yet they lack other foods. We've seen children who just feed on junk. I've seen children who are growing up and they are just feeding on milk, yogurts, ice creams. You see, these junk foods, only processed foods and sugars. And this has led to a lot of children having a lot of health issues like diabetes, hypertension. We've seen children these days, children start developing these problems while they're still very young. You know, these hypertension and diabetes are health issues that was not common to children back in the days. But these days, because of the lifestyle we are living, it has become so common, especially in children. So you find a 2-year-old, even children. I remember when there's a child who was diagnosed with diabetes at, was it around 4 months? She was obese. And at first the mother was given a warning that whatever you're eating is affecting this child, and the child is most likely going to get diabetes. And with time, the child got diabetes. And it's because of what the mother was eating. So you see, children are fed foods that are not nutritious to them. Giving them too much junk will make them become obese, and this obesity can lead to diabetes or hypertension. We've seen children getting heart issues, heart problems, because of the foods they eat. There are heart problems that are natural, that we can't control, but there are those that are led with, that are caused by the foods we eat, the lifestyle we are engaging in. And we see a lot of children who eat sugary foods and drinks. They tend to gain a lot of weight against their age. You find a child who is 5 years and they are almost 40 kgs, which is not normal. They're that age gap, that their age gap, and they have a weight that they're supposed to have. So you find a lot of children are overweight because of what they're being fed by their parents. What are the health risks of being overweight? We've talked about diabetes, we've talked about high blood pressure, we've talked about heart diseases, and there is also an issue with low self-esteem and social difficulties. You see, this child, once they are still young, you'll overfeed them or you'll give them that junk, they'll become obese. But once they start understanding themselves and their bodies, once they get the age of around 9, 10, 11, and they start interacting with others who also understand life, you'll find that they'll have low self-esteem, because they'll feel like they don't fit in with other children of their age. They'll see like they'll start being body shamed even by others, because they are overweight. They can't engage in activities that people of their age engage in. You find children in school, they're supposed to run, they're supposed to play football, but a child who is overweight, a child who has obesity, they can't engage in such activities, because after every 2 minutes the child is tired. The child starts having difficulties in breathing, so they'll start having low self-esteem. You'll find these children starting secluding themselves. They can't interact with others freely because of how their body is. Other children will start discriminating them because of their body. They'll start being body shamed because of their bodies. And what has led to this? It's what the parents has been feeding these children. So a lot of parents are making these children to have low self-esteem, to have mental issues at a young age because of what they are feeding them. So we should, as parents and as a community, we should try and feed these children with nutritious food. We should feed them carbohydrate. We should ensure that their food has carbohydrates, proteins, vitamins. You have fruits. Just give your child a balanced diet. And this child, let them eat food that moderate. Let them not overfeed and let them not underfeed. Let them eat food that is moderate to their bodies. Let them not overfeed, let them not underfeed. Also, apart from undernutrition and overnutrition, we have issues with physical activities and health. Physical activities comes in by children being maintaining their healthy weight, children having physical activities and muscles. It will also improve heart and lung health. It will help reduce stress and anxiety. And how are these children supposed to get physical? We've seen a lot of children these days, instead of going outside to play, instead of mingling with others outside, instead of being active with activities that make their bodies do exercise, they are staying indoors. They're staying indoors and they are doing a lot of screen time. We've seen parents who have invested in screens for their children. They have phones, they have tablets, televisions. So these children don't have life outside screen. And this will lead them not having good physical health, because they don't play, they don't exercise. And this lack of physical exercise will lead to poor health, will lead to children being either obese or getting diabetes because of not exercising their bodies. They have health issues like heart problems. Their lungs become weak because of not exercising outside. So these physical activities, what are we as parents, what is the way forward? We should start reducing screen time for children. And reducing screen time is not a punishment. It also helps them to create social networks. We've seen children who can't even converse with other children and with adults because they are not used to that. They can only converse with their screens. We've seen children who watch too much Nickelodeon, too much Cocomelon, and they can't create a conversation outside. We've seen children who have delayed speech because of a lot of screen time. So parents are the one who are poisoning these children while they are growing up. And it starts with a single parent. Just reduce screen time for your children, because it will also help them in their health. You've seen children who start having a lot of screen time while young. They'll start developing even mental health problems. Their eyesight become weak. Children cannot think because their brains are not set to their brain cannot think because it's not used to thinking. They're just used to sitting and watching. So reducing this screen time will help your children interact with others. It will help them create social network with other children and with adults. It will help them have physical exercise, and this will lead to good health. And it will also help in their daily activities will run smoothly once they start exercising their bodies. So we have lifestyle factors that are affecting physical health, and we've mentioned too much screen time. We also have poor sleep. We have children that can't sleep children are supposed to sleep for 8 to 10 hours. And we have children who will sleep for 4 hours, others will sleep for 15 hours. These poor sleeping habits, it will affect your child's health, because if they don't sleep enough, it will affect them negatively. If they will oversleep also, it will affect them negatively. As a parent, ensure your child sleeps for 8 to 10 hours. We've seen children who can't sleep because of screen time. They want to watch a lot and sleep less. So this will affect their health negatively. And this will affect the immunity of their body. If children lack enough sleep, it will affect their immunity and also their concentration. The concentration span of children will improve if they have enough sleep. But if you find a child who can't sleep enough, their concentration span will reduce. A child who sleeps a lot, their concentration also will reduce. We also have social and environmental influences that affect children and their health. So the first thing we've talked about, poverty and food insecurity. People who are poor and they lack food security, it tends to affect the social and environmental factors in children. We have lack of access to healthy foods. There are people who just can afford meals but not healthy meals. So it also affects their social and environmental influences. We have limited nutrition education. Lack of nutrition education to parents also affects the social and environmental life of children. We have cultural feeding practices. There are communities that feed specific foods to children. They don't care if the food is nutritious or not. So that cultural aspect of feeding also affects children. We have school meal availability. There are schools who have specific meals for children, and some meals are not nutritious. So schools also are contributing to the health challenges that children are facing. So how are you supposed to improve nutrition and physical health in children? First of all, we're supposed to encourage balanced diets which incorporates fruits, vegetables, whole grains, and proteins. This can be done in the hospitals during postnatal clinics, and also it can be done in the community levels. It can be done in churches. It can be done in a community by chiefs, and other leaders in the community. As a government, the government can also embrace this and start giving nutrition education to the community. We can promote regular physical activity and active play, either as parents or even in the community. Ensure these children have physical activities that will help boost their physical health and their health in general. Also, we should limit sugary foods and drinks that we're feeding these children. Children should be regulated on the amount of sugar intake they're supposed to take. And also, there's a time, I remember there's a time I read an article that after 4 p.m. children are not supposed to be fed with sugar because it makes them hyperactive, and that can also affect their sleeping schedule. So let's limit the sugary foods and drinks the children take and the time they're taking it. We should also support school feeding programs. As parents, we should support the feeding program and also give ideas on what can be improved in the school feeding programs. We should educate families on healthy eating habits. And here we've mentioned that the education can be done in the levels of hospitals, schools, churches, and even in the community. And also, we should ensure access to clean water and healthcare. We can do all things. We can educate them. We can provide these foods. But if we can't provide clean water and healthcare, we'll be doing nothing. So the government and the community officials should ensure that everyone has access to clean water and healthcare. The water that people are using for home use, the water should be clean. And also healthcare. Hospitals should be available. Hospitals should be easily accessible to everyone so that these children can have good health. And by doing this, we'll be creating foundations of children who have good health, good physical activities. And this will also promote will create a future with good children that have good health. So as we live each day, let's strive to ensure that we give good health and good food to our children, and this will help raising good and healthy children. You've been watching Gwira Gwira podcast. Thank you for following us, and we wish you a very successful day. Thank you.